So let's call the meeting to order. And Dave, you probably have a better record there of who signed on and who isn't.
Okay, so yeah, I see everybody on here. So who we've got on is myself, and then the board of health, we have Commissioner Schutte, Commissioner Trask, we have the chair, Peg Van Buskirk, we have Carrie Davidson, Randy Netherland, and Dr. Stein is on here. So, and then in the group, we have Carrie Gardner, who is a new physician in town, who talked to me earlier today. We had a great conversation. And I'm not sure who Brooke Quigley is. So
she's a commissioner from Mason Fire Authority, North Mason Fire Authority.
Okay. And then my staff, we have Lydia, we have Alex, we have Ben, and we also have our new police chief on there. So this is her first Board of Health meeting.
Very nice. And of course, we have Randy, Sharon, and Kevin. Okay, so can I get a motion to approve the agenda?
Madam Chair, I move we approve the agenda as presented.
I'll second.
Okay, all those in favor?
Aye.
And or aye. Okay, any opposed? Okay, let's move on. We have a resolution to set the meeting dates for this year, 2021. And I think you'll notice on there that the Thanksgiving week, we're moving it up, if possible, to November 16th. Does anybody have comments on that? Okay, can I get a motion to approve the resolution?
So moved.
Second?
I'll second that.
Okay. Any other discussion? No? Okay, let's call for the vote then. All those in favor?
Aye.
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 Any opposed? Okay, and no abstentions, I'm assuming. So now we have to elect officers for the next year. Any nominations? Basically, we just have a.
Madam Chair, would you like to do it again?
I feel like I didn't really even do it because of COVID. So I wouldn't mind. And I'm hoping that in March, we'll actually have a meeting because people are getting vaccinated. So.
Well, then, Madam Chair, I nominate Peggy Van Buskirk for chair.
Second.
Okay. All those approving?
Aye. Aye.
Okay. Any objections, I guess? Okay, we'll move on to the next action item, which is approval of the minutes for November 20th, or November of 2020, not November 20th. Can I get a motion, or is there any discussion?
Madam Chair, I move we approve the minutes as presented without change.
Do I hear a second?
Second.
All those in, or is there any discussion? All those in favor?
Aye.
Aye.
Any nays or abstentions? No? Okay. Then I'm going to move on to Dave, or actually it's Dan. Is Dan here? Yes. So we'll do the health officer's report. Dan, you're muted.
Sorry, I was trying to get off mute.
Okay.
I apologize for any background noise. I know that Dave has. I'm glad to still be here with you guys. I know that Dave has the majority of stuff to report. We are currently really focused on COVID. Of course, we're kind of in our third spike in the area. We have a couple of new variants that we're dealing with, but and we're working with the state to kind of strategize how to work with those. No current outbreaks that are going on, but we're watching several areas with previous outbreaks. The vaccine is rolling out, and we've got a vaccine clinic opening up this next weekend. And I've been working pretty closely with the schools to come up with safe plans to reopen. But I'm going to defer to Dave, who has a lot more details than I do.
Okay. Any questions for Dan before we move on to Dave? No? Okay, Dave, you're up.
Okay, so a number of things. So vaccine rollout is, of course, my first thing here. And vaccine rollout has been from the feds to the state to us somewhat problematic in getting a reliable estimation on what we're going to get and when we're going to get it. So we're still working on that. In fact, there's a meeting going on right now on my other channel here, talking about the vaccine rollout and looking at how the state's going to do mass vaccination clinics. And then we'll talk about how we're going to do vaccination clinics. The state's going to be doing 4 sites initially, and then adding another 3 as time goes by. And none of those sites are anywhere near us. Our concern with the state rollout plan is that the vaccines may get diverted from small jurisdictions to the larger vaccination sites in order to cover down on those. We did have a guarantee from Department of Health that the vaccine that we have locked up for the first vaccination, dose 1, we will get the same amount for dose 2. You're guaranteeing us that we're going to get dose 2. So where it comes in question is the period in between dose 1, dose 2. We want to have the next dose 1. Are we going to have enough for that group? So, and that's kind of in flux. We're working with Mason General and we're working with Peninsula Community Health Systems to address those. So you think of it kind of as a slinky. We've got dose 1 week, dose 1 next week, dose 1 the 3rd week. Then we're going to have to roll back in the 4th week to dose 2, dose 2, dose 2, and then back leapfrog it again. So there's a lot of coordination pieces going on here, and I'm going to let Lydia talk to it. Lydia's been kind of running our piece of it. We do have a vaccine clinic tomorrow in Belfair at the new school up there, and that's being run by Peninsula Community Health Systems, PCHS. We're looking to do, I think, 600 vaccinations tomorrow, and they seem to have a line on another 600 for their second dose. And if I'm right on this, I think, Peggy, you got 100 doses through the...
Yeah, and that was gone in minutes and still hundreds of questions, yes.
So there's we're still in the demand outstripping supply.
Yes.
Some point this spring, that's going to flip, and then I think a little more work for us on the PIO end of things. But right now, we've got plenty of demand for the doses that we've got. So I think that piece is going to go well. It has been confusing, and I will say that what we've gotten from the state has not been extremely straightforward. Conditions have changed several times. Even last Monday,
I know.
from the Saturday before, when we talked with the governor's staff and thought we had an agreement, on Monday it was different. So it just happens that fast, and we really are asking folks to be patient with local public health, because we're trying to get this stuff out the door and into arms as fast as we can, but we're having to deal with a system that's outside of our control. So we're making progress. I think it's going well. We're using primarily, well, we are just using the Moderna product at this point. It's easier to control all the variables with Moderna. We don't have the 80 below 0 holding capacity, but we do have a physician in town now who has an 80 degree below 0 freezer. So if we do come back into the Pfizer product, we have some place we can store it. So, and he has said that that is available to us if we need it, because he's doing some other work with drugs that he's using that require the super cold as well. So we have that. We've had a ton of volunteers. I mean, the community has been absolutely great about volunteering, stepping up, going to WASERV and getting themselves listed at WASERV and being ready to come work for us. And Lydia will cover that in her piece. What we're foreseeing in the near future is probably only maybe a 5% increase to local vaccine distribution in the next few weeks as they gear up the big vaccination sites. And we should know more. But like I said, we talk about this several times a week with health officers and with the Department of Health, trying to keep up on what's going on. I think the reception to the vaccine has been good. I mean, we've got people who are filling up our registrations very quickly and still asking for more. People are just going to be patient. This is going to be a long process. I don't see this phase, and I'm going to call it group, because people come in groups, they don't come in phases. So we have the group 1As, which were the firefighters, EMS, hospital folks, 1A. We're now in 1B, tier 1, which are the 65 and older and the multi-generational households. So that is a big group. If you look at it for Mason County, we're talking probably 23,000 people are going to be in that group. If you take a 60% uptake, and I think with this group, we might actually have a better than 60% uptake based on the demand I've seen. You're still talking close to 20,000 people to get through. And when we can only do 600 to 1,000 at a time, it's going to take quite a few of these clinics because we have to do them each twice. So there's a lot of coordination that's going to go into this, a lot of expense that's going into it. On our side, on the public health side, because people who are working in the mass vaccination clinics aren't working in their normal work, their normal grant work, which we get paid to do. So we do have money coming from DOH. We do have some funds left over from the COVID relief, which were extended to June 30th to use. And then the legislature is also working on some pieces of legislation to get us some money to cover those expenses. DOH was gracious in upfronting us money. We should be seeing that very soon to get us through the first 3 months when our cash flow is low, and so we start rolling into the summer. So questions on vaccine rollout?
Just really difficult. I still have to fill in prescriptions in between vaccines, you know, so it's kind of hard.
Yeah, so our staff is volunteering, got their first vaccination on Friday. So to include me.
Actually, I'm going to come and get a vaccine on Friday.
Oh, good. So like I said, we have a clinic tomorrow, and we have one coming up on Saturday. And again, Lydia will talk to that. Okay, phased recovery.
Dave, just two quick questions.
Sure.
On the vaccine rollout. Number one, on average, how many do you think we're giving out regularly here? Break that down per day, per week, whatever. And how much do you think we need to increase that by in order to make a difference? Number one. And number two, have you heard anything on what DOC's vaccine rollout is for their prison system? We have a couple of facilities in the county, and that plays into our roadmap to recovery. And have you heard anything about how they're rolling it out?
No, I haven't. I don't know if Lydia has, but I have not heard anything. They're really under their own system. So really all we get is a report daily of their new cases. So I haven't heard anything on but they have their own chain that they're going through from the state. And I know they're making progress on it because I've heard through Scott Lindquist, the state epidemiologist, that they have their own vaccination program underway. So I imagine by now all their staffing is done, and they're probably working through the inmate population. And our first question was, daily use. So daily, I think we're probably not hitting 200 a day across the county with the clinics that we have right now. PCHS has centralized their vaccination distribution to one location in Kitsap. So 4 days a week, they're doing vaccinations in Kitsap, and 1 day a week, they're coming to Mason County to do vaccinations. And their intent is to keep that going for quite a while. And when they come to Mason County, they're looking to do 600 a week in Mason County. That's what their allocation is. So they're working, and they've already taken care of all the North End, fire, EMS. So now we're starting to work into that tier 1B, tier B1 group. And they're making progress on that. But down here in Shelton, we're running primarily through a clinic at Mason General. And they're looking, they haven't come out with it yet, but they're going to be stepping up and putting more of that into the clinic setting. So the doctors in the clinics will be able to work with their patients as they're being seen for other things and offer the vaccine as well. The problem we have is once that vial is tapped, there's a 6 hours, you've got to use that. So It's a coordination piece. We have to make sure that we get that done. And each of the Moderna vials can do 10 vaccinations. So if they punch it for one, you've got to get 9 more. So, and that has caused a little bit of confusion in the last couple of weeks because they had a little bit extra that had been thawed, ready to use, and they had run out of 1A folks, so they grabbed whoever they could, and that creates some confusion in the community, and that's been settled down, and I think we're moving forward. We are going to be doing some here for county employees, and that has been coordinated through Mason General, and our county HR department is working on that. For those folks in B1 that are 15 and older, multi-generational, and then 65 and older. So we have a surprising number of county employees who are 65 and older. Does that answer your question?
Yeah, I appreciate that. And I guess just maybe one other follow-up, maybe either for you or Peggy, I guess. So how are pharmacies managing or will manage their supply and getting people who are eligible in? What's the process looking like that?
It's all going to have to be online, register online, because like he said, once the vial is open, you have to give those 10 doses within 6 hours. So not wanting to waste, you have to have 10 people lined up so you're not wasting.
Sure.
So it's all gonna, and I don't have time to schedule people. It's all gonna have to be online because we still have to fill prescriptions. So we're only scheduling right now 20 people a day, even when we get 100, so that we can move it throughout the week so that we're not inundated with 100 in a few hours.
Yeah.
And only pharmacies have it at this point. It's not broadly distributed with other pharmacies. My husband is a pharmacist and does not have it yet. He's getting set
and
potentially have it, but
right.
Yeah.
Well, we just got ours, and we've been on the list for I don't know how long. So
Yeah.
Right. We have been told that Safeway would be receiving theirs last week, and they did not receive it, from what I understand. So.
So are we trying to?
Are we trying to what?
I was gonna say, are we trying to coordinate with pharmacies in the county, or what level of conversation are we having at the staff level with them, so that if there's ways that, we brought on a vaccine coordinator at public health, is there a way that we could maybe engage with them to help?
It all has to be put into the state site. So if people are going on findyourphasewa.org and then they click on where to get the vaccine, any place that is available in their area should come up. I'm saying should because the website has not been easy. In fact, our website went down this morning 2 or 3 times because everybody's trying to get on it.
Right. And Peninsula PCHS has pulled theirs off of the state site and relying right now on word of mouth to go to their website, to their doodle poll to register. So
right
there, it was crashing not only their website but their phone system and their email as well. So people are definitely interested.
I've got a question too. I know that it's not the phase that we're currently in, but the Shelton School District employs a lot of people, and they are going to be in the following phase, I believe. And we received information, the school board received some information that was then going to be possibly done as an on-site. Is that then, are you thinking ahead to the coordination of that and working with them so that our teachers and teaching staff and anyone associated with the schools can be vaccinated, and there can be that additional layer of protection for those people as we try to bring kids back to school?
So the teachers and a number of groups come into that group 2, B2, with law enforcement and teachers, courts, jails, and then the aggregate workers. So grocery store workers, agricultural workers, food packing plant workers. And we're looking to reach out to all of those. So for example, one of our shellfish companies wants to get all of their folks to one location, get them all done at the same time. And kind of to meet your thought, at first it was those 50 and older in those subgroups. And then in phase 3 or 4, we would come back and get those under 50. Well, we pleaded our case to the governor a week ago Saturday, and he did come out Monday with a positive change to that to say, if you're going to go to an employer and you're going to do aggregate folks, do all of your aggregate folks,
Yeah.
and not make 4 trips when 2 will do. So that was, I mean, jumping up and down good news for us in the logistics and everything. So yeah, we'll be working with the schools, we'll be working with the shellfish companies, with the timber companies, all those folks that have, that meet that criteria in the next phase, next group.
And hopefully with Peninsula, they have a in with the school. Hopefully they can do North Mason. I don't know how that's going to work, but we do need all our teachers vaccinated.
Yeah.
It's probably as important as healthcare workers.
And I know
Hey, Dave.
on just more vaccination becoming available.
Yes,
That's the biggest key right there.
that's the huge thing. Okay,
I have just.
Hey, Dave.
Oh, sorry.
Really quickly, I was just curious. Because the vaccines are being distributed through our partners, do I need to sign off on any of the vaccine plans?
I think so. I don't think so.
No, what I've received, Dr. Stein, from the state is basically you sign off, or I can sign off on the local mass vaccination clinics, but on the ones coming through the partners, pharmacies, for example, don't need any oversight.
Because ours goes directly through the state anyway.
Right. Well, what we do have Christopher, who's working out at DEM, who tracks daily everything that comes in and everything that goes out, because all that as of the 24th has to be reported daily. So we do have eyes on what's going on.
Okay, so can I just ask a clarifying question? So are we working with the pharmacies, the hospitals, anybody that's distributing the vaccines? Are we working through or with them to help us figure out who's doing what and when?
So we're working, Lydia, I just cut you off. I saw you go, we are working with the hospital, we're working with PCHS, and then as it gets into the pharmacies, that piece kind of is run by the state. So there's less coordinating for us to do with those folks because they're in different coordination group than what we are. So really what we're going to be doing are the larger vaccination clinics are going to fall back on public health in partnership with Mason Health and with PCHS.
Okay. There's a lot of confusion, I think, in Mason County as to who's doing what and why. And so that might be something that we might want to work on messaging, getting some messaging out there saying, helping people clarify where they should go, who's doing what and why, because I think it's confusing for everyone. I've been working this since February and it confuses me. And so
absolutely, because the original plan from the feds was this was going to be done through pharmacies.
Yeah.
And then that didn't happen. So, I mean, all of us are having to adapt, and it does get confusing for the public and us as to what's next.
Yeah.
Changes every day for us. So it's hard to keep up.
And the information changes every day that
Yep.
I have to give out to my customers too.
Yep.
So anyway, okay. So how are we doing on the health officer search?
Okay, I'm going to step back to phased recovery for just a sec.
Oh,
So,
okay.
Our last Board of Health meeting, we were in phase 3 of the initial phase plan, and the governor has since come out with a new set of phases, and the whole state now is in phase 1, which is if you took phase 3 and you added all the restrictions put on November 15th, that's what we're at now. So phase 1 is what we're at, and we are grouped with Kitsap, Jefferson, and column counties. So in order for us to move into phase 2, all of us have to move at the same time on a group not demographics, but group stats that we're not meeting yet. So race per 100,000, occupied beds, open beds, and case positivity rates are the 4 criteria. And in order to move forward, you have to have a green in all 4 criteria. And in order to stay in that phase, you have to have 3 in each category. If you hit just 2, then that group of counties moves backwards to phase 1. And this can happen as much as weekly under the system. We'll get letters. We got our first letter on Friday, this last Friday, and then we should be getting letters, each Friday saying what phase we'll be in on Monday morning. So for us, it's going to be a matter of getting the word out on Friday afternoons if we do have a phase change, and trying to get the word out to our local businesses. One of the biggest concerns is you have food service businesses that don't have time to order in and have the food stocks on hand to go up a phase. And even worse, if it goes down a phase and they have a bunch of food ordered in, now what do you do with it? So especially on the fresh foods. So it's going to create some scrambles on the weekends sometimes, I think, as we just luckily, I guess, by going with groups of counties, there should be more stability. We shouldn't have a real roller coaster ride. It should be the advantage of bigger numbers is, yeah, it takes longer to move a bigger number, but it takes longer to move it the wrong direction too. So in some ways it does work in our favor. And that's kind of where we're at now. There is no phase 3 and phase 4 yet that have been published. So phase 2 is all we're looking to get to in the near future. What advantage it has is I don't have to go back through and write a plan and run it through DEM and run it through the commissioners in order to have a plan to go forward. It's just automatically going to go forward based on our statistics.
Okay.
Okay.
Now,
Done. Health officer search. So we've had some applications, and we have one that just came in today that looks good. So Dr. Stein has agreed to stay on, but he is, and Dan, correct me, we've talked about this, but he needs fewer hours and has agreed to take less money in order to do those fewer hours. So we're talking just a few hours a week, 4 hours a week, and then brought back from the $4,000 a month to $2,500. And we can do that. It is a little more difficult for Dan, a little more difficult for us if we have a local one. We had opened it up to people working remotely to do this. We have concerns in if we have somebody who applies and say works on the East Coast, they don't have an understanding of the knowledge of our community. And I think it's very important for somebody to be involved in the community and have a knowledge. Dan's got that. He was here for a year before he moved, so he knows what's going on in the community. He knows the players and very involved with the schools especially. But I'm just getting guidance. Do we want to continue that, or do we want to roll some qualified folks together and put together an interview panel and see about getting somebody who has more hours available? And not to diss on Dan, but we're just looking to make his life easier and then have somebody local for us too. So I'm just seeking advice from the board.
Madam Chair, if I can jump in first on that.
Sure.
I want to start by thanking Dan Stein for agreeing to stay around to do this in a time when all across the state they've been abandoned by some of theirs. Thank you to Dr. Stein and for Dave Wyndham and your staff for picking up the slack that's necessary. But I couldn't let it go further without starting with that special thank you, because you don't have to do this. You didn't have to do this. And I very much appreciate the fact that you are doing it. So thank you, Dan.
Any other
It's been my
comments?
pleasure.
Any other comments?
Madam Chair,
Yes.
just real quick, have we looked at a poll? Have we put it out there so that we know maybe if there is interest? I guess that would be my first question.
As of today, I've got a couple of good candidates that are local.
So what we need to do maybe is set up a interview group. What do you think, Dave?
I think that would be helpful, you know, if we could do that and just see what we have out there, do an interview, and if you know, this is a chance for them to see if they like us and if we like them. So it's kind of a two-way thing. And Dan is still here, so I think it gives us flexibility. We don't have to jump right off the bat. So I think if we can put together a small pool and then do an interview, that would be great.
And didn't you have a small pool set before for
Well,
interviews?
Yeah, we had and then as we got to checking, they weren't licensed, or they were great epidemiologists with a huge background, but they weren't MDs or DOs and had no
Okay.
ability to write scripts. So we had to eliminate a lot of people just because they didn't meet the basic criteria.
So I don't remember who was on that committee before, but do you think we could pull them together again?
I think so, yeah.
Okay.
If
I
you
know
end up
I
one
felt
shy and there isn't already a commissioner doing it, I'd step up and help if you need it. If not, it's better for me, but
Well, if we had a commissioner and two other board members and myself and maybe Lydia, that would be a great panel, I think.
I think I had
That'd be,
volunteered before, and I'm still interested.
Okay.
I'd be happy to consult on that as well.
Okay.
That would be great.
So if we have Commissioner Netherland and Carrie and Dan, myself and Lydia, would that be a good panel?
That would be great as far as I'm concerned. Anybody else have comments? Okay, let's go forward with that.
Okay. Okay, so good. And then fiscal, wow. Yeah, that has been a roller coaster as well. So we spent a pile of money in December. We bought a lot of PPE. We bought a couple of trailers. Part of the idea on that was we had the CARES Act funding to buy PPE, and we're pre-positioning things. We have some in South County. We have a trailer in North County, so that if something was to happen besides an epidemic, a pandemic, so we have an earthquake, we have stuff positioned in places around the county that we can get to. So we're good to go there. We have a lot of PPE. We're distributing a lot of PPE through Area Command. Area Command has been great about getting things out. We received 95,000 N95 masks, N95s in the last few weeks, and we're getting those out across the county. So huge amount of things going through. What has happened though is DOH has not paid its bills yet. So we're waiting for DOH to get that money back to us and bring our cash flow back up. So we're watching that very carefully. We have gotten our first of the year money for the Foundational Public Health Systems money and a couple other grants. So that keeps us afloat for right now. Foundational Public Health is very flexible in how we spend that. So that's very helpful. And trust me, anything COVID fits in Foundational Public Health. That's what we're supposed to be doing. So that's easily justified. And we're continuing to do grant work. The grant work is coming in. It's just that money from CARES Act that we spent up front, we're waiting for that money to come back from DOH. So, and I have a call into the CFO to say, hey, can you give us a timeline on where that money's coming? So the thing is they got flooded with all these A19 reimbursement requests at the same time from every health jurisdiction across the state. So I know they're working through those. Other than that, we on the food permits that we normally are getting in this time of the year, January, we go out and get the food permits. We have postponed those because our restaurants aren't open. It just felt really horrible to try to tag people for food permit for a restaurant that's not open. So we have postponed those with commission's approval, and those will come back later once we start getting people open. And I'm hopefully thinking that is it for me. It's just been a very, very busy 2 months over the holidays with the constant changes. And I have to say that the staff in community health, environmental health, and then building planning, permitting have really stepped up. We've got a great team in public health. You won't find better. And our area command, I think, is unmatched in the state on how we have reacted to this. Dr. Shaw, that's another thing. Dr. Shaw, the new Secretary of Health, is here. we were the first health jurisdiction he came to see. So it's like he came to see the problem child first. But we had a really good 2-hour meeting with him. It was very congenial. We got to know a lot about him. And I think if he follows through on what he said he's going to do, we'll have a really good relationship with Dr. Shaw.
Great. Okay, Alex, you're up next.
Yeah, good afternoon, everybody. So I submitted my EH report for you all. I see my permitting graph didn't convert very well for some reason, but in short, permitting was busy in 2020, as I've been reporting throughout the year, primarily tied to the economy and new construction market, which is mainly what that means for us is septic and well permitting. So staff has been very busy with that. In December and January, we worked heavily on getting our licensees recertified for the year and completing year-end reports for DOH and grants. We've been working with our commissioners and partners on our water quality program needs. And this is related to being proactive versus reactive on health threats related to shellfish harvesting. In between all that, I've been helping Lydia and Dave with our COVID vaccine efforts. And we still have a few staff doing COVID related work, supporting Lydia and her crew. But I think that's it. I don't have a lot for you guys this meeting. Is there any questions for me or environmental health?
Report looked good to me. So any other questions for Alex? Okay, let's move on to Lydia then.
Good afternoon, all. You received my report as well. I guess I wanted to just say with regards to that, you can see how much is still being done in community and family health, just like environmental health, even though COVID is a focus and a huge priority that we're focused on. So I'm proud of the staff and how much they're shifting back and forth between COVID duties and their own programs, which we, as you can see, we have quite a few still operating. We never really shut down almost anything the whole year. So our staff has moved to online, but they've still been getting a lot of things accomplished. And some things are still being done in person, like our mobile outreach, which is going on right now. So as far as the COVID report, yesterday, our 2-week positivity rate was 217% or 141 cases in 2 weeks, which brings us back to it's the lowest it's been since mid to end November. So we're on a downward trend right now, even though it doesn't sort of feel like that sometimes in our offices, but we are. We are, as of yesterday, at 1,555 cases in Mason County. You will see that that differs from DOH's report. We have been working for 3 weeks trying to reconcile things with DOH. They're responsive, but things aren't changing on their report. So, because theirs as of now says 2,057 as of yesterday. We know that some of those are our WCC, and we've been working with them to get them to remove those. They did finally agree to make a separation in the WDRS system and put all of the WCC into its own line instead of filtering it in with all of our regular positives. Unfortunately, they still haven't separated the numbers in their data report. So we're still working on that with them. So hopefully we'll get to reconcile and be the same number at some point soon. We've also given 2,100 doses in Mason County between Mason General Hospital and Peninsula Community Health Services and some pharmacies that are being able to give some. So that's where we're at right now. We're getting, I think we have a couple more thousand doses ready that are in the process of being distributed right now. We were given notice 1 week ago today that we were expected to do mass vaccination clinics, and they opened up, as you heard, the next series without any notice to us. I'm very proud of all of the people that helped pull everything together in literally 1 week's time to get mass vaccination clinics going and registrations going. And that includes our public health staff, the Department of our emergency management staff, school locations, and working with us in our and getting signatures from the commission on getting our agreements with them so we could utilize those facilities that we've had for 15 years, agreements with them to utilize facilities in emergencies. Mason General Hospital and Peninsula Community Health Services, and the pharmacies. It's just been a record thing in 1 week's time. I think it's amazing. We have scheduled, the Peninsula Community Health Services has their first tomorrow mass clinic in the North Mason area. They've worked very hard, and Chris has worked very hard to help them in getting some logistic things done and supplies. We're looking forward to that. And then on Saturday will be our first one in the Shelton area. And registration was questionable. Both every single county is having the same problem. We're hearing reports from everyone. All counties are just panicked because it's hard to get people registered when you have so little supply and so much demand. People get very angry very rapidly because they don't understand why I didn't get into the clinic. Our poor front office is bombarded by calls, as is Mason General and Peninsula. I saw that Kids App, some places are shutting down their phones because the reality is we can't do it. It's too many people calling in, it's crashing systems. Ours worked really well. We put a notice out on our 599 vaccine message line, county line, on Friday, letting people know that on Monday morning, we specifically and purposely did not say the time. On Monday morning, we would be opening up registration for the Saturday clinic. And we were hoping to do 1,000. We ended up having to make it less than that because of logistics. We cannot move that many cars through in a 7 or 8 hour day. So we used a program that our Melissa, our EPI person, community health person, thought of. And we put it up, and we had never used it before for anything like this. It's a survey type program. And it went up at 8:30 in the morning. IT put it up. And we also had a backup for phone. So people who didn't have computer access, they could call in. And we had a line for that was being answered. And we had 4 people rotating to, so that we could try to keep up as most as we could. In 10 minutes, when we checked the data on the program, we had already put in 500 people in 10 minutes registered. So one thing was positive. We were very excited it didn't crash the system because we didn't know what was going to happen. It worked perfectly. The phone was, is difficult, but it's what it is when people call in. We were very amazed after we looked at the data. We have 666 people actually registered, pre-registered for the Saturday clinic, and we've closed the clinic. And we had to close it in 30 minutes so that we weren't bombarded with more registrations than we had, than we could handle. Not necessarily than we have vaccine for, because you've got the other logistic problem of handling cars and people moving through. So most clinics we're finding are doing about 600 vaccines. We're hoping by moving to a different location for the next one, and that's trying to be decided right now between a couple of locations, to try to take in more cars so that we could actually handle more people. And we're trying to shoot up to 1,000, but we'll see how it goes. We're working towards that. And then, of course, once we go through the vaccine that's currently we have, we're ordering more. The hospital is ordering more, but then we will see what we get, because we're not going to know. So it's hard. We can't really set up a clinic until we know we're going to have vaccine, because that would be harder on people to tell them, sorry, we set you up, but we're not going to have vaccine. So we're excited. We'll see how it goes. We're thrilled that registration went as well as it did, even though people were angry because, of course, you only got 600, almost 700 people in the registration, and people don't realize there's over 20,000 of them out there trying to get in. So we can only do what we can do. And we're finding that all of the other counties around us are in the exact same pickle. They're just running into the same problems. But we did learn today from the state. We were talking to the state about some issues with uploading the information into their system once people are vaccinated. And we were talking with them about that, and they said that they're hoping soon to have a program that will register for any kind of clinics, mass or anything. And I'm sure they need that if they're going to do huge mass clinics in 4 areas across the state. So they're planning that. And then it will also upload that information to the database for the state. So we in Mason General and Peninsula will not have to hand do that. So that's really exciting to hear that that's coming. And I'm sure it's coming since those clinics will be coming shortly. Let's see. We have had great volunteers coming in, and they'll continue to come in, and eventually we'll use less of our public health staff and probably more volunteers to do these clinics. Our goal is to try to do one at least once a week. We're working very closely with Mason General Hospital and Peninsula. Peninsula is already scheduling one a week in the north end. We're going to try to be scheduling 1 to 2 between us and Mason General Hospital as long as we have vaccine. But that's the goal, is what we're trying to go for. So Commissioner Schutte, you had asked earlier about how many people are we going to be able to do. It's limited because of their mass. You can't push them all in a building. We can't do it the way we used to. You have to, so the car thing seems to be the best and keeps people safe, but then you need places that you can handle hundreds and hundreds of cars in a certain amount of time without blocking traffic. So those are the things we're dealing with. Any questions? But it's going well, I think. I think we've had a good job this week in 1 week's time.
Yeah.
Without notice.
I had a question, and I'm really happy to hear that the system didn't crash and you were able to find a way for people to do those appointments. I am wondering, with these mass vaccination, will those people automatically be scheduled for a second appointment?
Good
at
question,
the time
Mary.
they're waiting?
Yep, they're already scheduled at the time they leave. They're going to set up the next mass vaccination, which would only be for those that made it through that clinic. Yes.
Okay, thank you.
And then we have, with Mason General, we have a program where people who live close by, and when they have extra vaccine and they need to finish that vial, they have people that come within 10 minutes and they'll come get a vaccination that fit in the category. So we're trying to make sure there's no waste of vaccine or anything, and get as many people in as we possibly can, as fast as we can.
Yeah, that's fantastic. I think having those waiting lists, because I know that there's lots of people that would like to get this done as soon as they can.
One of our ahas that was kind of pleasant was we were very concerned about this particular group, many of them not really being computer savvy or internet savvy to handle certain things and register. And we found that only 20 out of 666 did not have emails. And we had only about 40 call-ins that are actually, and only 20 of those are coming to pick up the information here. So we're finding this population has either got their family by their side and helping them, but they're accessing, and I'm hearing the same from other counties, that they're just accessing, they're knowing that this is going to be done technology-wise, and they're doing it. But we do have the phone backup, talking to a live person to make sure we can help those that don't have it.
Lydia, that's great. The one thing I just want to add is that right now our demand outweighs our supply, but
Yep.
at some point in the hopefully near future, our demand is going to or our supply is going to outweigh our demand. And so I think that there's going to be a lot of hesitancy with getting the vaccine. And I think starting to think now about how we're going to be marketing it and trying to encourage people to be getting vaccinated is going to be important to look at.
Yep, something we'll do after we get through this big bulk. I think this is going to take quite a while.
Lydia, or Dave or Dan, can you also clarify, I know the timeline between the first shot and the second shot has been extended, and some people are going out past 28 days. So can you clarify and maybe just assure people that it's okay?
So,
Dan, I'll let you do that.
So they're still recommending it as close to that date as possible because that's what was studied in the trials. Sorry for the background noise. The they have the CDC has come out with some statements about extending the possible timeline for getting that second vaccine, which is probably okay.
The Moderna one does say that it's possible that it could even go out to 90 days,
Yeah.
but it's better to do the 28.
Thank you.
Okay, is that it, Lydia?
Yep, unless there's any other questions.
Okay, I guess we move on to Ben.
And Ben, are you on? Ben
Yeah.
has, yes, there you are, Ben. I've been trying to reach you and I couldn't reach you.
Oh,
Okay.
I'm
Go
in,
for it, Ben.
I'm in Dr. Stein's old office. Maybe that's why.
Okay.
So, first of all, I'd like to also welcome Brooke Quigley. She is one of our Substance Abuse Prevention Coalition members, and I invited her to this meeting. Brooke and a few others have been some of our dynamic prevention leaders in the North Mason area, and we have some down in the Shelton area. We meet once a month, typically separately as a North Mason Coalition and then a Shelton Coalition, but we just most recently virtually have been meeting together quite a bit because we've been working on a lot of policy work that affects the entire county. And so one of the things that has come up recently is a lot of temporary allowances that have been made because of COVID, and they're business allowances mostly. We are pro-business. There's no way we want to, close shops down or have them lose funding. But some of the allowances that the Liquor Control Board the State Liquor Control Board has done has created some questions in our minds on if they're happening now, will they be happening in the future after COVID? And we've been asking a lot of questions. We invited Drew McEwen to attend one of our coalition meetings, and actually we ended up getting his assistant to attend. And I'd like to invite Brooke to interject if she has thoughts too. But some of the state data and national data through CADCA, which is the Community Anti-Drug Coalitions of America, who I go through a lot of trainings through them. Couples drinking has gone up 4%. Couples with children, families, the adults drinking has gone up 11%. Binge drinking has gone up 3%, and family family has gone up 12%. And sales of alcohol has gone up 25%. So people are using a lot more. I think a lot of you have probably heard there's a lot of anxiety, a lot of stress, higher suicide rates or suicide ideations during this time people are at home. And we have been talking about how we can affect drinking and drugging in our community and help try to reduce that. And this policy work that we've been doing it all summer long. And I wanted to just share some of the issues that are happening out there and that you may or may not be aware of that potentially could go beyond COVID. So the first one is curbside pickup of cannabis sales and drive-up windows. Right now, people are allowed to drive up to or call the retail store just like you're driving up to pick up your food, and they call the retail marijuana shop and order whatever they need, and it gets walked out to their car and delivered, they pay by credit card or however, cash, and they just drive off. The same thing's happening with alcohol. And personally, this has happened to me. I was ordering dinner at one of our local Mexican restaurants back in June, and my wife wanted a margarita with our dinner, and they actually gave me an open container in plastic with a straw, and it was pre-mixed, and I ended up driving home with an open container. It was odd at the time, but I thought it was just kind of the sign of the times. Minors are also allowed in cannabis shops with adults, are allowed to go in right now. I mentioned alcohol deliveries. Minors can also be in bars and restaurants that serve alcohol right now with adults, as long as they're supervised. I mentioned pre-mixed cocktails and delivery. One of the big issues is people are driving up to places like Walmart or Fred Meyer or some of the bigger stores, and they're popping their trunk, and the store worker comes out with a bag of groceries, which includes alcohol, and they'll put it in the trunk or the back seat, and they're not always checking IDs. They don't always know who's actually buying those products. So we're looking at, ensuring that if any of this stuff continues, that some of the policies of at least checking ID is tightened up and followed up with. We're concerned about, really the youth in our community. It's, this stuff, online buying has increased by 4% also of alcohol. So we know that, some people take advantage of these types of things. And what I'm trying to do today with you is let you know that this is happening. We want to protect our children, and we want to be able to show support when these come up publicly to vote, statewide. Now, it probably won't come up at our level, but if you're doing having any discussions with our state leaders that have influence with any of these laws, I think our coalition would really appreciate your support in suggesting that they don't, these laws aren't allowed past COVID in the future. Do you have one other thing that I wanted to talk about is some of the other things that we've done recently is a retail marijuana shop survey, where I actually went around to every retail marijuana shop and looked at their signage, if they're having sales. Apparently they're not allowed to have like 30% off sale signs, not allowed to have like cartoon signs, promoting towards children. I think Brooke mentioned at one of our meetings that lighting is an issue at some of these places. They're just so, bright and just different than most other stores and how they promote. Some of the stuff might be stuff we may or may not be able to work with the store with it, or with the liquor control boards with in the future. But I think it's something that is out there. It's something that our families see. It's something our children see. And when you drive by a marijuana store, you know exactly what it is. So they're effective, and they're promoting promoting their product to our children. So I want to know if Brooke would like to say a few words about our direction. And
Sure. Ben's talked about issues that are related to temporary allowances, and hoping that those temporary allowances don't go beyond the time that they're needed for physical distancing during COVID. And so and we're hoping for support that if these issues come up in the legislature, that we have support that those temporary allowances are stopped. and he's mentioned the other things which we're sort of working on that aren't temporary, but are just the messaging to the community that we're doing in how we are advertising drugs and alcohol. We in North Mason don't have large billboards with alcohol, but we do have them with cannabis. And we're sort of looking at a whole cluster of things where you have posters, billboards, really happy, festive lighting that cumulatively sort of give the message of this is okay, it's benign, and it's, I think, attractive to young people as well as adults. So we're trying to think about this. We want to be good partners with the businesses, but we think the businesses also want to be careful in how they're advertising to children and to young people. And so we're hoping we can be cooperatively engaged with them to, I think we're hoping, tone it down. It's such a large message in our small area that's related right now mostly to cannabis. So since we're in the business of thinking about prevention and thinking about things kind of down the road, we're thinking about young people in our area and the kind of messages we're sending them.
I'd like to really point out that our coalition is both coalitions are totally on board with policy work. And this is probably one of the first times we've brought up any of the policy issues to the Board of Health. We have done some other work in policy, but some of it was already state mandated, for instance, the tobacco and vape issues. A couple of other issues that have come up are homegrown marijuana. Apparently, it was a big thing before retail, and then it was not allowed. But now they're asking for people to be able to grow up to 6 plants per person and 15 plants per household. And then also selling alcohol in stores that are less than 10,000 square feet. That's kind of a big one too. So more of your mom and pop shops would be able to sell alcohol. Again, we don't feel that providing more of this is probably a good idea for our young people. It's just too easy to get, bottom line. Any questions?
Well, I have a question. Is there something you would like us to do as a Board of Health to support your efforts, or?
I think just giving you the information is right now important to let you know that it's actually just out there. And there are a lot of us that are working. I'm on a statewide, it's called Prevention Voices Group. And these are the types of things we've been working on. And yeah, just informing the board, I think, is our goal today. And if there is a time when we'd like support, and I'm not sure what that would look like, we might come back and ask for that support.
Okay.
My last announcement is we have a Hidden in Plain Sight training tomorrow night virtually. So that email should be going out either as soon as I get off here or early tomorrow morning. That gives the Zoom address or the Zoom information for that training. It's tomorrow evening, 6:30. It's for parents or adults 21 and older. It's really kind of interesting where the presenter shows where young people might be hiding some of their paraphernalia, drugs, that sort of thing.
Okay.
All right.
Anything else from you, Brooke?
No, but thank you. And I'm really struck and impressed by all the work that everyone's doing in this very difficult period of time. I really appreciate what you're doing.
Okay.
I have a quick question. First off, thanks to you and Brooke for all the work that you do on this. It's incredible. And we know the budgets are shoestring, and it's always difficult to get prevention money, particularly from the state. And so we're always kind of chasing it. So first, just a big thank you to you both and all your partners. Maybe more of a question for Dave on the planning side. So Brooke and Ben had mentioned some of the signage that we see, the big billboard type signs in the county. Is that something that could be addressed through our sign code, and maybe have the planning commission take a look at that?
You run into the Reed versus Foster decision, and it's constitutionally protected speech. You can't regulate a sign by what is on the sign. You can only regulate it by its placement, construction, and size.
Right. So so I wonder if in some of these cases that there may be those distance issues from certain restricted areas where that advertising would be prohibited. So, within so many feet of a school or whatever.
So that's still out there. I think it's within 1,000 feet of the school.
Yeah.
So I wonder though how they got around that with the tobacco and alcohol, because they're not allowed to do tobacco signage that way, I think.
But we're talking about signs, not signage, two different things. So
Okay.
signage is something that's on the side of the store or in the store or on a display. A sign is defined as something that's along the roadside that can be seen, and it has construction standards attached to it. It has a building permit attached to it.
So, but there are billboards, which is a sign, correct?
Mm-hmm.
Okay, yeah. North Mason actually or Belfair actually has a giant billboard with
Yeah.
a,
And that's
I guess I ask because I know you can't have, tobacco is a good example. You can't have, you could advertise Camel probably cigarettes, but you can't use, was it Camel Joe or
Yeah.
whatever, you can't use the Camel, and so there are some restrictions on that. And so I just, as we maybe think about how to, tackle this issue into the future, there might be worthwhile looking at it from that perspective.
yeah. Well, like I said, I think we have a really great group of people that are pushing these issues and actually, leading our state, our Mason County coalitions have been asked to do a lot of great work at the state level when it comes to this. So we will continue to work on these things for our youth in our community, and we'll just continue to report back to you guys and let you know when it's time to get your support.
Okay. So I think now we're up to other business and board discussion, and I see Sharon, you have your name there. Did you have something you wanted to present, Sharon?
Why, Dave?
We talked about that. We talked about area command, and we were talking about those things, and we were also yes, regionalization.
Oh, that's right.
Mhm.
Yeah, so that's a big bill that's coming before the legislature, and it is a very scary bill, in my opinion, as it's going to lump us with people that don't know, with other counties that are not familiar with Mason County and the way that we run things. It affects not just medical, but it also affects our environmental folks. And so it will be a costly bill. There's another bill that's going before the Senate, I believe. So there's a House bill, and that affects the regionalization of the public health. And then the funding bill is going before the Senate. And I believe that is being heard tomorrow. So both of them, if I would encourage everyone to take a look at those bills and contact your legislators and let them know how you feel about that. The more we discuss it, the better, the more we can help realign it so it doesn't hurt Mason County.
So Dave, did you send us out the numbers of those bills already?
Ken, when I last sent stuff out to the board, a number hadn't been assigned to the governor's bill. But I think now it's House Bill 1110.
1152 and 5173. 1152 is the bill that is the vehicle for the regionalization of public health.
Right.
The 5173 is the funding bill. There's also another bill that is 1110, and that is the reorganizing of boards.
Right, boards of health bill, yeah. So we'll get those sent out to everybody.
Okay. Any other comments?
We have one last thing on the ordinance that was sent out about the composition of the Board of Health.
Right. And that was in our packet,
Right.
and that was something, wasn't it? But the commissioners are the ones that have to approve that, right? And they already did?
Is a recommendation from the Board of Health. So what we've added to this is added a line that talks about, and we're going to rewrite this a little bit based on some feedback from Dr. Stein. Adding a provider. What we want to have is another medical doctor on the Board of Health. We listed that in this resolution. So this resolution would, if it goes through here, it's a recommendation to the Board of County Commissioners who have the ultimate authority to set the parameters for the Board of Health.
One just quick clarification on there. Dr. Stein's recommendation was that it be open to providers broadly. So an MD, a DO, a PA, or an NP, a physician assistant or a nurse practitioner. And the thinking there, if you look at the wording as it was provided to the group, we had a member in good standing of the Thurston Mason Medical Society. We want to keep somebody who's practicing in Mason County, obviously, that's important. But Dr. Stein, who is a past board member and on the executive committee of the Medical Society, felt that might be a little bit too restrictive, given the makeup of their membership and some of the, that there's some financial obligations that are associated with being a member of the society. And so those were the two changes that he recommended. And I think they make sense, is just pulling the medical society out and opening it up to the four types of provider that provide, healthcare in the county. I did have a conversation with the executive director of the medical society, and at first blush, they were supportive of us adding a seat to the Board of Health for a provider. So there is no objection from them, but it just wouldn't name them specifically.
Okay, so this is something that we have to pass on to the commissioners, I'm assuming. Dave, is that correct?
That's correct, yeah.
Okay, so do I hear any other comments or motion?
I have just a question, clarifying, I guess. We have the Squaxin and Skokomish tribes on here. How often do we get a representative from them to attend the meetings?
We've not had one since I've been here.
We have never had one that I'm aware of, but I still would like to try to get them to come, and it doesn't look like it's affecting our quorum.
How do we solicit? I mean, I think to Sharon's point, how do we solicit the organizations that are listed to send a member?
And I think that might be a little difficult with the Indian tribes because they have their own hierarchy. And if you don't ask the right person, you will just get snubbed, is what I've been told. And I don't know. Dave, do you have any?
Yeah, we have reached out and we just have received no response.
And
I talked with the tribe one time about it a couple of years ago, and I was talking with elders of the tribe, and the response I got was, you wouldn't invite your president to your Board of Health. That's what I was told. And so I said, well, could the president, your elders, choose someone else that they feel would fit into the category? And we didn't kind of get any further than that. But they felt like if you bring elders in, that's not the people that should be in the meeting. So I'm still puzzled about it.
So
Okay.
Lydia, do you think you could reach out again and maybe see if there's someone that isn't an elder that could sit?
Yeah, you know, we can reach out to our clinics in both tribes, the health clinics, and see if they could decide how they would want to pass that message through and come back with an answer to us. We can try that.
Yeah, because I've just been told if you don't ask the right person, you're not going to get anywhere.
Well, and the resolution states a representative. It doesn't say what type of a representative either.
Right.
Yeah, and since we're collaborating them with both of them right now, probably more Skoke more than Squaxin, but both over COVID, it kind of be a timely thing to try
To
again.
reach out. Yeah. And like I said, it doesn't affect our quorum if they're there or not there, but it would be kind of nice to have them included.
Yeah.
They are part of us.
Yep.
Agreed.
Okay, any other discussion? Oh, I guess we have to pass this or not pass it. Do I hear a motion?
So moved.
As amended,
As amended.
Yes.
I'll second.
All those in favor?
Aye.
Aye.
I think there's still four. Yeah, there's plenty of us to vote. Any opposed? Any abstain? Okay, I guess it passes. It goes to the commissioners.
Okay, I will make those changes and get it into the briefing schedule.
Thanks, Dave.
Okay, so then any public comment? No public. Okay, so do I hear a motion to adjourn?
So moved.
Second.
Okay, all those in favor?
Aye.
Aye.
Aye, let's adjourn. Okay, see you in 2 months.
Thanks, everybody.
Thank you.